In this video, we'll be talking about the classification of various periodontal diseases and conditions. So first of all, I'll list the basic headings, and then we'll get further into them. Yeah. So first one is gingival diseases, plaque-induced and non-plaque induced. Then we have chronic periodontitis, localized or generalized. Then we have aggressive periodontitis, again localized and generalized. Then we have periodontitis as a manifestation of systemic diseases. Necrotizing periodontal diseases, abscess of periodontium, periodontitis associated with endodontic lesions. In this, we further have NUG, NUP. In this, we have periodontal abscess, pericoronal abscess, gingival abscess. In this, we have endodontic periodontal lesion, then periodontal endodontic lesion, then combination. Then we have developmental or acquired conditions or deformities. Localized tooth-related factors that predispose to plaque-induced gingival disease or periodontitis. Second is mucogingival deformities or condition around tooth. Then mucogingival deformities condition around edentulous ridge. And fourth one being occlusal trauma. Alright, now we'll discuss them each in detail. So first one is our gingival disease, which is plaque induced and non-plaque induced. So now we will talk about them in further detail. So dental plaque induced gingival diseases and non-plaque induced. In the first one, we will talk about gingival disease associated with plaque only. So with local contributing factors and without local contributing factors. Then gingival disease modified by systemic condition or disease or factors. So in this further we have endocrine, puberty. In this we have puberty, then pregnancy. In endocrine we have puberty associated gingivitis, menstrual cycle associated gingivitis, then pregnancy associated gingivitis, pyogenic granuloma. In this we can further talk about associated with blood disorders, like leukemia associated gingivitis, leukemia associated gingivitis. Then third, gingival diseases modified by medication, drug associated gingivitis and drug associated gingival enlargement or overgrowth. Then gingival diseases modified by malnutrition, ascorbic acid deficiency associated gingivitis and others. Alright. Now in non-plaque induced. So gingival diseases with bacterial associated with bacterial infection, Neisseria gonorrhoeae, Treponema pallidum, Streptococcus species. Now gingival diseases due to viral infection, linear gingival erythema, uh, then herpes virus infection, primary herpetic gingivostomatitis, then recurrent oral herpes, varicella zoster. Then gingival diseases associated with fungal origin, Candida species infection. Here you can talk about linear gingival erythema as well, and histoplasmosis. Then gingival diseases, genetic origin, hereditary gingival fibromatosis. Alright. Then gingival diseases associated with systemic condition. First is mucocutaneous lesions. In this, you will talk about pemphigus, lichen planus, linear lupus erythematosus, then erythema multiforme. Alright. Then you can talk about allergic reaction to restoration or agents in dentifrices. Then traumatic lesions, mechanical, thermal and chemical. Then foreign body reaction. Alright. Now these are the plaque induced. Now chronic periodontitis and aggressive periodontitis. So it is localized and generalized. Less than 30% and more than 30% of the teeth are involved. In this localized and generalized, first of all, it should involve first molar and it can involve incisors. Alright. But in this, more than 3 teeth plus involving first molars and incisors. Alright. Now this we'll discuss in further details in another videos. Now in localized tooth related factors that predispose to plaque induced gingival disease, we will talk about, I think I can write it here only. So in this basically you have to write about the margins of restoration, then root fracture, then cervical root resorption. In these deformities, mucogingival and vestibular, we will talk about frenum, vestibular depth, keratinized tissue, amount of keratinized tissue present. Occlusal trauma, TFO, basically primary occlusal trauma and secondary occlusal trauma. So this completes the classification of periodontal diseases. I hope I made it easier for you to understand and learn. If you liked the video, do subscribe to my channel. Thanks for watching.